Hello, my name is Eric Zuniga, and today I'll be talking to you about Rasmussen encephalitis, also known as RE. Rasmussen encephalitis is a chronic T-cell mediated disorder affecting the central nervous system, but more specifically the brain and a single cerebral hemisphere. This disease typically presents itself in childhood. The causes of RE are unknown, which make it extremely difficult to diagnose and treat. The symptoms of RE come in stages. Stage 1, intractable seizures. Intractable seizures are seizures that cannot be controlled or treated with medications. Stage 2, the seizures become more frequent and neurological deterioration begins to set in. Stage 3, permanent defects. Permanent defects such as hemiparesis, which is severe weakness of one side, congenitive deterioration, which will affect your memory and thinking, hemianopia, which is blindness, and aphasia. There are two main types of seizures. You have your generalized seizure and your focal seizure. First, we will start with generalized. Our absence generalized seizure is a patient will stare, non-responsive, but comes back like nothing has happened. This can occur many times in one day. An atonic generalized seizure is a sudden loss of muscle tone. The body will just go limp. A generalized tonic-clonic seizure is what most people think of when they hear seizure. This is where the person will contract and spasm along with having breathing issues. When they come out of it, the person will sleep afterwards and have no recollection of the event. These seizures are extremely dangerous because the person will stop breathing, and with the lack of oxygen to the brain, which will cause more damage than what RE is already causing to the brain. And it will also affect the unaffected hemisphere of the brain. The myoclonic seizure is a short-lasting seizure, only can last a few seconds, and can have a series of jerks, and one does not lose consciousness during the seizure. Now we'll move to our focal seizures. We have a simple and complex. Our simple seizure can be subtle. While the person cannot control the seizure itself, he or she remains aware that something is going on. For example, a simple focal seizure might cause an involuntary movement of the leg and an occasional sense of deja vu or perception of an odor that isn't really there, such as smelling bacon when nobody is cooking anything. A complex focal seizure may impair consciousness, or the person may lose consciousness entirely. People experience one may appear spaced out for a moment or have a repetitive behavior such as picking at their clothes or smacking their lips. When it comes to diagnosing RE, it is not easy. There are only two options: an MRI or an EEG. An MRI is able to show specific images of the brain to show swelling of the tissue and affected hemisphere. An EEG records brain waves which can show where the seizure starts and ends, which allows the doctors to pinpoint exact location of the infection. Now, when it comes to routine blood tests and cerebral spinal fluid tests, also known as spinal taps, these do absolutely nothing for RE. The main treatment for RE is surgery. It is the most effective. And in surgery, you have four options: a corticectomy, a corpus calostomy, multiple subpial transection, and a hemispherectomy. Now, a corticectomy is a removal of a specific portion of the cerebral cortex. The corpus calostomy severs the membrane that divides the right and left cerebral hemispheres that interrupts the electrical signals from seizures. The multiple subpial transection is a series of shallow cuts into the brain's cerebral cortex. The most effective surgery there is for RE is a hemispherectomy. This is the complete disable of the affected hemisphere or the complete removal of the hemisphere. Medication does not help this disease. The long-term effects, depending on your treatment, can be uncontrollable seizures, neurological deterioration, hemiparesis, congenitive deterioration, hemianopia, and aphasia. These are all possible long-term effects depending on your treatment. Thank you, and I hope you enjoyed my presentation.